when I first got involved in research as an independent investigator was in 2005. And so that first year, I was awarded one of the grants, which was a blessing because for a young investigator starting out, it's not always easy. And the one thing that the foundation grants do, especially a specialty grant like this dealing with aplastic anemia and MDS, is it gives you some credibility when you go to apply to these larger national grants that are funded by the NIH. And so it really provided me that first foot in the door in MDS. And I was switching research slightly when I started, so I think the timing of it was perfect, and to get that recognition from the foundation that they believed in the ideas I was putting forth was really important and positive. And so that started work with it I've continued, which was really related to sequencing. And that sequencing in 2005 was preliminary before this next wave of next generation sequencing came out. But without sort of getting into the research into sequencing, using that, I really wouldn't have led to my continued interest in using this technology to try and understand mutations in patients. And so over the time, collaborative work has really yielded identification of mutations. And then in 2012, I was awarded a second grant from the foundation, which in some ways was a direct extension of that original grant. And that's because the mutations we identified along the way, now we were able to go back and try and understand what they were doing. And the money and the funds, again, were critical at that juncture because we were really early in the studies. And again, to try and compete at the government or NIH level would have been a little premature and difficult. But yet, I think the foundation recognizes this early phase research and again, was able to get an award. And then that's really led to the development of a preclinical model where we're now trying drug treatments for these specific mutations. So in that time from 2005 to now, at two critical junctures, the foundation has really supported me, and I don't think I would be able to be here the same level with my accomplishments without some of that support. With MDS in particular, which is what I focus on, there are some effective drugs, but there are a lot of patients that just don't have adequate response to the drugs that are available, might not be able to get a bone marrow transplant, which is a curative potential. And so I think if we understand better the mutations and the biology of the disease, it's really to be able to offer them some form of treatment that can either prolong survival or even ameliorate symptoms that they're having. And so that's really been the goal. And I think recently with our research, trying to now take the mutations that we identify and see what we can do therapeutically with the ultimate goal of bringing that to clinic for the patients is the long-term goal. Yeah, the unique thing about AA and MDS International Foundation is that it really brings together the researchers as well as the patients. And there's, as an example, the website, just a common portal for people to enter and use for resources, local outreach, and they even come to St. Louis and have patient-oriented meetings where the researchers are able to participate and directly sort of educate and offer this outreach. So I think it's a common site for patients to come and learn, but also for the researchers to exchange ideas like at the symposium that we're at now, as well as to get funding to continue research, which really ultimately we want to cycle back to the patients. So that's, I think, the uniqueness of the foundation. Young researchers, there is becoming increasingly competitive at many levels. But what I find with the foundation is that it's a very fair review process, and you get experts in the field reading specifically your research that's related to aplastic anemia or myelodysplastic syndromes. And so it is a place that you absolutely have to apply. and you'll receive good feedback with that. And I've encouraged many people at my institution to apply, and we've continued to have people apply for grants from Washington University. So first, thank you to the people that have funded the grants. And for those of you considering funding and donating money for grants, it's a critical need currently in research. And as the national budget has been restricted in the past few years, individual foundations are really stepping up and making a big difference. And even small amounts of generation, when pooled together, can really be critical, especially for young researchers that are just starting out like I was. And so I would encourage people to follow their hearts, and any little bit can help and be pooled together. And I would just encourage people, because it's probably the only way we're going to move forward, is if we do it as a group.